riding a bike really is the ultimate form of freedom in my mind. It's a great anaerobic workout. It's fun being out on the open road and just seeing the road rush under your wheels. My name is Mike Thomas. I am 55 years old, and I am the proud recipient of an Onyx valve. I spent 28 years in the uniform of the United States Army. I retired in September of 2010, and I've worked for the Department of the Army as a civilian since then. This time last year, I was competing in some cyclocross racing. I noticed some of my heart rates were pretty high, 235 beats per minute, 217, 220. After the races, I felt like I was going to pass out, and I knew that just wasn't right.
I really enjoy helping people and making people feel better and help people live longer and healthier lives. My name's Jeff Gesa. I'm an assistant professor of surgery here at Duke, specializing in adult cardiac surgery. You take someone who has aortic valve disease, either stenosis or insufficiency, in Mike's case insufficiency, and they feel terrible. They're short of breath, they're tired. Mike's having heart failure symptoms, so he needs taken care of.
The realization that I was going to have open heart surgery was the singular most scary part of my entire life.
It's a big deal to go through heart surgery. It's very stressful. It's very stressful for the patient. It's very stressful for the family.
Going into the procedure, we discussed the options of a tissue valve versus a mechanical valve. Biggest disadvantage for me was that a tissue valve would have to be replaced in 10 to 15 years.
He's a guy who wants to maintain his lifestyle, but doesn't want 2 or 3 more aortic valve surgeries in his lifetime. A mechanical valve, it's going to last the life of the patient.
When I came out of the procedure, my surgeon told me that they had used a state-of-the-art valve made of carbon, and it was called an Onyx valve.
You have to have utmost confidence in the devices you put into people because they're supposed to last. People's lives depended on it. The Onyx device is a great bi-leaflet mechanical valve that has excellent hemodynamics. The pressure drop across the valve per size of the valve is better than bioprosthetic valves. And so you actually get a better hemodynamic result. In other words, the heart has to work less to get blood out of the body, and you feel better.
I immediately started feeling better, right off the bat. I was thrilled to death that the surgeon had the foresight to pick this particular valve for my particular situation.
A mechanical valve lasts forever, but you do have to take a blood thinner. The special coating of the Onyx valve, we can run a lower INR. That helps people have lower rates of thromboembolic complications as well as bleeding complications, which is a big deal.
When I first came out of the surgery, taking the Coumadin, my blood levels were 2.5 to 3.0. And now my blood thinner levels are between 1.5 and 2.0. As a matter of fact, my last reading was 1.7, which is just barely above somebody that isn't taking any blood thinner medication.
That's the selling point right there, and I think it matters.
Taking Coumadin has not been an issue for me at all. I don't think twice about anything, tell you the truth. I get out, I ride my bikes, I do different things, I'm not worried about it. I want to get out. I got a lot of living to do still.
Mike's long-term outcome is excellent. I mean, this valve should work the rest of his life. He should not need another procedure. Hemodynamically, it's going to allow his heart to work excellent. I think his outlook is phenomenal.
I don't know if I'd be standing here today, to tell you the truth, had I continued on the path I was on. Now that I've recovered, 7.5 months post-surgery, I am totally functional. I've resumed all normal activities. Matter of fact, I felt so good I bought a new bike, which is sitting back over there, that I'm gonna race soon. When I can feel my heart beating in a strong, healthy way, it's just the best feeling in the world. It really just lets you know that you're alive and to enjoy the life we've been given, to help others, and to try to leave some kind of legacy so that the dash between your birth year and the year of your death really means something. I'm so thankful. The Onyx valve literally saved my life.